Candace Owens recently launched a new podcast with the Daily Wire, and her very first episode is sharing her birth story. And while some of this is a story of her birth, it also includes a significant amount of medical misinformation. As a board-certified OBGYN, I could not let some of the things that she says in this video go because they could be extremely harmful if people don't know that what she's saying isn't accurate.
So my story starts with, and if you're a woman listening to this, you'll know what I'm talking about, the many tests that you have to get while you are pregnant. One of them is for Group B strep, GBS, right? They say, we're going to test you for GBS.
You do not have to get any test in pregnancy. We recommend a variety of tests which are evidence-based to improve overall maternal and neonatal health. Group B strep is recommended as a screening test because we can improve outcomes, which I will talk about in a moment, by testing for that and knowing about it and being able to treat it.
Now, if you're listening and you're wondering what even is GBS, I've had kids, I'm from a different decade, we never had to do this test. Well, what you are told as a woman is that it's a regular colonization that takes place in every woman's body. But
she's almost right when she says that it's a normal colonization that everyone has. That's not true. It is a normal bacteria that can be found on the skin, but not everybody has it. Current database estimates are anywhere from about 15 to 40% of people will be colonized with Group B strep.
They think that if you have a certain amount, I guess a certain number, or this colonization is bigger than usual, they recommend that you undergo antibiotics while you are giving birth.
The reason that people didn't know about Group B strep screening in maybe the 70s or 80s is because Group B strep emerged as a leading cause of neonatal mortality in the 70s. And it took quite some time after that to identify where the infections were coming from. So yeah, before we had identified that it was a problem and why, screening for it and treating it wasn't a thing. That makes sense. Neonatal GBS at the time that it was identified had a case fatality rate, meaning of all the babies that were diagnosed with this, 50% or more would die. That is a massive number, and it's still incredibly dangerous today.
Now, here's the first thing that you should know, and they will tell you this, the doctors will back this up. You can test positive for GBS on a Thursday at 2 p.m., come back and take that test at a Thursday at 6 p.m., and you won't have you can test negative. It could go away within a couple of hours and you might test differently.
Not quite true. Tests are relatively predictive of colonization status for around 5 weeks. So if you look at the actual data, there's only about a 2% chance of somebody who tests positive at 36 weeks converting to negative by the time of delivery.
But if you test positive even once, they're not going to retest you, and they're going to recommend that you go on an antibiotic course while you are giving birth.
That's only once in the last 6 weeks, or in a sterile urine sample. Not only once ever, because that amount of time is where the risk is signified. But a urine sample is different because it's a colonization in a sterile body site.
I don't like antibiotics in general, and I decided to look up exactly what this GBS was, what the statistics surrounding it were. Is this actually going to be harmful to my baby as she's exiting the womb? And
whether it's a risk to your baby is completely up to chance. Of course, everyone who tests positive does not have a baby that ends up with neonatal GBS. That's not how this works. The same way that arriving home after a bunch of errands around town with a kid in your backseat that's unbuckled but fine isn't evidence that they don't need a seatbelt. Your kid being fine, even though they didn't have this risk reduction observation period or the treatment, doesn't mean that it wasn't needed. It means statistics were on your side in that incident. It's about 50-50 whether the neonate will also end up being colonized. And obviously all of those don't get disastrously ill, but 50-50 rate of colonization for a bacteria that causes terrible neonatal outcomes if it becomes invasive is a pretty high number. And we also know that implementing testing and screening has drastically reduced this. There is a definite correlation with a positive test and the risk to your baby. That is not meant to say everybody who tests positive will have a sick baby. That's just not how viruses and bacteria work.
Of course, what I found was that dark hole of statistics that basically told me 0% of babies are harmed by this.
Invasive group B strep is thought to be the cause of almost 60,000 infant deaths, 37,000 childhood onset lifelong disabilities, and up to 50,000 stillbirths every single year. This is nowhere near 0% of babies being harmed. Neonates of Black mothers are at an increased risk of invasive GBS as well, thanks to systemic and overt racism.
If your baby is harmed by this, they say that perhaps the baby could stop breathing, but there's no way to isolate whether or not that child that stopped breathing because of, for say, the vitamin K shot that they give your child as soon as they come out of the womb.
Of course, there's a way to tell if a baby is affected by Group B strep. All it requires is isolation of Group B strep from a normally sterile body site like the blood or cerebrospinal fluid of a neonate. It's actually quite easy to make this diagnosis. We know without a doubt that neonatal infections related to Group B strep have fallen significantly since the implementation in the United States of screening and treating to prevent the baby from catching it. She keeps mentioning that they just get sleepy, but they don't just get sleepy. These babies get very ill. We look for somnolence because that's an early indicator that a baby is sick, but that's not like what the disease process is. It's an indicator that we need to be looking to make sure something worse isn't going on. We know the outcomes of GBS and what it causes in a neonate. Things like pneumonia, sepsis, meningitis, these are all complications that are related to neonatal GBS. The risk of dying if they get diagnosed with one of these is about 3% if they're a term baby and about 20% if they're a preterm baby. These are very real, very dangerous infections. This risk to these babies doesn't end when they go home. If you have a baby that has GBS and they get readmitted to the hospital or admitted into the neonatal unit, once they are discharged, they still have a 3 times higher mortality rate for their first decade of life. This is very serious. The reason is because it can cause damage to underlying organs like the lungs or the vascular system. On top of that, they are much more likely to be admitted to the hospital in their first 5 years of life, and they are much more likely to suffer long-term sequelae like cerebral palsy, seizures, learning disabilities, hearing and vision impairments. This is not just a babies get sleepy issue. It's a very serious diagnosis. I will concede that every baby who has a GBS positive mom does not end up getting GBS, but every baby who has a GBS positive mom is at significantly increased risk of getting that, and we know how to decrease that risk with getting a couple of doses of penicillin in labor.
For me, I go, this doesn't really make sense, okay? And I do not want to take antibiotic. It is my personal choice. It was my personal decision. That is the backstory that you need to know leading up to this.
I have no problem with declining medical interventions. This is something I feel very strongly about. A well-informed patient may decline whatever intervention that they would like. I think that's an important aspect of bodily autonomy, which is often forgotten in pregnant people. You do have to know that the pediatricians are going to recommend that they watch the baby for 48 hours afterwards, because that's the point where signs and symptoms of Group B strep may start to pop up, and catching it early can make a huge difference in outcomes. This is the same recommendation that goes for people who really wanted treatment, but they labored too quickly to get the doses of antibiotics. So it's not a conspiracy to punish people who decline antibiotics. It's simply the protocol to make sure that the neonate is as safe as possible.
Now, I tested positive for GBS at about 14 weeks, and the doctor said, we do not, give you another test about this. I have no idea, is what I mean to say, whether I am GBS positive as I'm about to give birth.
This is the case where she's tested positive in a first or early second trimester urine screen. This is a situation where we don't retest, and the reason is because even if you test negative, because you have tested positive in a site that's normally sterile, meaning it should not have bacteria like the urine, that means your colonization level is higher, and even with a negative test in the weeks preceding delivery, you still have an increased chance of your neonate catching this. So that's why we don't retest.
Day arrives, and I have, ladies and gentlemen, a perfect birth. My daughter was out in 2 pushes. She's beautiful. She is a healthy 7 pounds and 3 ounces. And mom is exhausted. As you guys know, that it's exhausting to give birth. It's exhausting to carry a child.
Congratulations. I'm happy that you had a lovely delivery.
And all I'm looking for is some sleep. So we get put up into our room where, of course, if you would like to stay for 48 hours, you can. And I'm under the assumption that if I'd like to leave earlier than the 48 hours, I'm also welcome to do that.
From a maternal standpoint, absolutely. The 48 hours in this case has nothing to do with her. It's because there was GBS identified, it was not treated, and the reason for not treating it is completely irrelevant. You could want it and not get it because you labored too fast, or you could decline it. It doesn't change the recommended management from pediatrics.
Your body has just done something that is incredible. You are rightfully tired, and if they could not knock on the door and let mother and child sleep, they will be better for it. But you are not allowed to sleep in a hospital after you've just given birth. Knock, knock. It's a nurse at the door, and she says, "We've got to check your child's vitals." Great. That's a good thing, by the way. I think that's a good thing. You want to make sure they don't have a temperature. 15 minutes later, it's knock, knock. We have to check your vitals. I'm thinking, okay, well, it would have been great if you could have done this at the same time. And this happens about every hour. It feels at least like every hour. Maybe it's every 2 hours. They just keep checking on the vitals of mom and the baby to make sure nothing has changed. And they knock, knock. We're here to weigh the child. Okay, well, I just gave birth to her maybe 5 hours ago. Kind of seems strange. You need to check her weight again, but all right, that's fine. Knock, knock. Dolly Parton's books. I kid you not. I had a knock on the door while I was in the hospital. So fatigued, just wanting to close my eyes. And it was I guess they say it's a captive audience, and it was from Dolly Parton's books. And they say, you can sign up and you can get books for free for the first year. And it's for free, so why wouldn't you? And I literally said, thank you, but no, I just want to sleep, I just want to sleep. Knock, knock. Hospital photography. Do you want us to take photography of your infant? No, mom just wants to sleep. How many people can I say this to? I literally just need to close my eyes. Please stop selling me stuff. My husband's exhausted. I'm exhausted. My baby is exhausted.
You absolutely should be able to sleep more in a hospital, and this is not always done very well. People should not be coming by your hospital room to sell you shit, but it's absolutely ridiculous. That should not be allowed. And if someone doesn't have a medical need to be there, they shouldn't be there bothering you.
Knock, knock. We're here to test the baby's hearing. And at this point, I remember thinking in my head, I can guarantee you that my child can hear, because every time you knock, she's jolted from her sleep.
Having a startle reflex does not guarantee a baby can hear. They can startle at very small vibrations that happen, including the knock on a door.
But nope, we have to check to make sure that she can hear right now, today, just a few hours after she's arrived, because I don't know, I guess there's something different that can take place. I mean, the last I checked, I don't believe that people that are not even a day old can be fitted for a hearing device. What difference would it make to allow a mother to sleep and to instead perform that test, I don't know, a week later when she's at the pediatrician?
Early diagnosis and intervention significantly increases the chances that a child will end up with effective communication and language skills as they grow, and screening while you are inpatient allows this screening to be equitably provided to everyone who has a baby. And we know that hospital screening has improved outcomes.
I want to take a nurse hostage right now. That is how I am feeling, because you won't stop knocking and letting me rest. And I have communicated this over and over and over again to every nurse that's knocking. My baby was born, by the way, she was born at nighttime at 7:30 p.m. So it was all the next day that they kept knocking, and it was once again nighttime. And the moment came where the night nurse was coming on duty, and it was a woman named Diana. I will never forget her. Very, very sweet woman. Very sweet, seemed a little bit clueless, but totally harmless. And I said, I have one request tonight. And she said, what's that? And I said, I just need to sleep.
Why would you, to an audience of potentially 700,000 or 800,000 people, publicly name your postpartum nurse, who is undeniably overworked and underpaid and working in a pandemic, name them and call them clueless on a public platform?
Can't tell you how much time went by before I hear a faint knock on the door. I guess Deandra's solution was she was just going to be a little more quiet, right? So I'm just going to be quieter when I knock. I suddenly hear my daughter, who was completely knocked out cold, start wailing. I see my baby has been put on a scale, that cold scale that all babies hate. You think that weighing a baby, we're talking 2 o'clock in the morning, you thought this was a necessary intervention. But of course, every knock in a hospital is a cha-ching, right? This is what they're billing you for. Knock, knock. take this medicine. Knock, knock. We have to push on your stomach. Knock, knock. We're here to give you Advil. Knock, knock. We're here to check the vitals. They know that this is dollars, and they're not going to stop making money in the middle of the night. So they've come to weigh the baby. I mean,
we are not billing you for every time we check on you, Candace. That is not what's happening. Now that you mention it, though, I do think it is quite silly that people get massive bills for being in the hospital. What's your stance on universal health care so people don't get these massive bills? Okay.
A serious question. I'm not even pretending that I know everything about this topic. How much weight can a baby reasonably lose within 24 hours? I mean, she's feeding. I mean, how much weight could she have reasonably lost from being born one day ago to this moment at 2 a.m. in the morning? I don't know. That's an open-ended question. Again, you guys can tell me if I'm wrong and I'm missing something.
I can't comment as to the timing of the weight and why it was chosen at that time. And if it was for no reason, then I absolutely agree. Decreasing interventions, particularly at times where somebody is sleeping, should be priority. However, newborns can lose a significant amount of weight, but more importantly than that, knowing at 24 hours how much weight a newborn has lost can give us an idea of if they risk into a category that's at high risk for going home and losing a concerning amount of weight that requires them to be readmitted. These weight checks are really important because we can risk stratify babies that are at risk for too much weight loss and get resources, counseling, information, and important follow-up visits for those families. So it is really important. And again, I do not disagree with decreasing interruptions. This is a problem. But at the same time, I don't think it's fair to equate interruptions with malice on the part of your healthcare team.
So at this point, I just get up and I'm so angry and I say, we're leaving.
So I'm just editing, and I want to add in that I think a lot of what we're going to hear in the remaining part of the story is honestly a big part of it is a problem with the communication on the part of her healthcare team. I don't want it to be missed that a primary issue going on here is poor communication about those things on the part of the healthcare team, and just a little bit of de-escalation and compassionate, autonomous communication with her probably would have gone a very long way. So the beginning part of this, I felt like it's really important for me to debunk some of the not correct information she's giving about Group B strep. But the remaining part of this video, although there are a few things that I will correct as far as insurance billing and legality things, I want to make it clear that much of what she's about to tell us is really important because it happens all the time with patients not being listened to by the people on their team in a way that makes them feel autonomous and able to make decisions. And much of what she's about to tell you can be attributed, at least in part, to poor communication from her healthcare team. In addition to that, we know that the burden of this failure to listen to your patients falls more heavily on people who are Black or in other marginalized groups.
Oh, she said, we have not yet performed the newborn screening. Now, the newborn screening, in case you guys don't know this, is a test. It's a blood test that they make babies take, infants, of course, among the other tests they have to take. And they just run to see if they have any, genetic issues that will come up in a basic blood test. And I'm saying, I want to get out of here right now. This blood test can be performed at a later date. We will take her to a pediatrician. I want to leave right now. And she kind of made a face like, okay. And I need to go get the head nurse.
Newborn screening is where we identify any kind of metabolic conditions or genetic conditions which can be intervened upon and prevent death or serious morbidity to the baby. Studies have to come up with normal ranges for these numbers, and those ranges will change with time and age. So the lab is intended to be done at specific times, which is somewhere in the first 24 to 48 hours of life, with a second screening done in the first 7 to 14 days of life. When you start doing it at random times without this specificity of a recommended time frame, you're going to lose some of the accuracy of the testing. If those metabolites are increasing in the blood, we want to give them enough time to get where they're abnormal, where they can be identified, but not so much time that they're abnormal and cause problems. So delaying this to the pediatrician visit could allow a condition to be at a level where it's already caused permanent damage when it could have been caught at the time of hospital discharge and intervened upon.
And she comes back with a woman who has a form. They hand me this form, right? It is just before 4 o'clock in the morning. And it is a form, and she even highlighted the section that was relevant. It says, I have been informed that under Tennessee law, Title 68, Chapter 5 requires these tests, and that a refusal of these tests is a misdemeanor. I kid you not when I say I just started laughing. It was like a maniacal. I didn't even understand. I was in another world, another haze. I thought to myself, am I starting to hallucinate? Do I have actually a nurse in front of me telling me that it's a misdemeanor if I do not submit my newborn baby's blood to her? Am I understand? I just laughed. I just went, I said, can I see that form? Can I take this home? And she went, uh-huh. And I said, and for my understanding, when you say a misdemeanor, am I going to write a ticket? Am I going to get arrested? Do I have a court hearing?
It's a law. We didn't make the law, nor do we want to be the people who have to inform you of this. Unfortunately, we've been told we have to give you that information. We're required to. We're just trying to do our jobs, Candace.
And my husband said, okay, we will wait until you take the baby's blood. Okay, we will wait, but we want to leave immediately. So she then says, well, we can't. Even if we take the baby's blood test right now, we can't let you leave in the middle of the night because you have to be signed out by the OBGYN and the pediatrician.
This is true. Nurses can't discharge people. The doctors have to give an okay for the person that they admitted to the hospital to be discharged.
By the way, I want to say this. I'm not against, obviously, infants getting blood tests. I think it's a good thing to know whether or not your child is born with any issues. And it's likely saved some lives. It is quite extraordinary when you're told that it's a misdemeanor if you do not submit your blood to the state.
That's fine. You can be against that, but you cannot take it out on our nursing staff because they have to provide you with that information. They didn't make the law, they don't enforce the law, but they have been tasked with giving you information about what the law is. If you have a problem with the law, take it up with the people who make the law.
But a conspiracy theorist might think, okay, is the state doing something with that blood? Why would they make it so severe that it's a misdemeanor? I don't tend to ever think that the state loves your children so much that they put in place a law like that because they just want to help kids that maybe have some genetic disorder.
Unequivocally, the reason that this test is important and required is because most of these cause early death and or significant brain and mental impairment if they are left untreated. With treatment, you have completely normal outcomes in many of them. That is why they are included in the newborn screen.
A month after I gave birth to my daughter, this article popped up. Police used a New Jersey baby's mandatory blood sample to pursue a criminal case. Public defenders and a newspaper are now teaming up to sue over privacy concerns. Somebody in your family gets convicted of a crime because they used that blood to track them down.
I agree, that's not an appropriate use of these tests, but this is a very irresponsible presentation of information because she's talking about having wanted to refuse that. She's throwing in a one-off story of something that is illegal. So people are listening to this, getting the idea that what's happening in mass is people misusing the DNA from these samples, which I agree. If that's happening, it's not in mass. But if it's happening at all, it's a problem and we should deal with that. But it absolutely should not be presented in this way. It is far more likely, magnitudes more likely, that this information is going to save their child from a very serious health outcome than it is that that is going to be used for a malice purpose. This is so irresponsible.
And we wait for the pediatrician and the OBGYN to arrive. In fact, the OBGYN woke me up about 6 a.m. As soon as she got in, I was dozing off and she said, I want to let you know that I put a sign on your door not to disturb you. I think she was a very sympathetic woman. And she said, I want you to know that I have signed you out. So when you are ready, you can leave. And that was all I needed to hear. We jumped up and we started packing up our bags. The pediatrician is the only person left to sign us out. And I will never forget her name. Her name is Dr.
Once again, completely irresponsible to use people's names on a platform to hundreds of thousands of people. This behavior can end up with healthcare workers being abused or potentially even put in dangerous situations.
Clearly, she did not make this a priority. It was about another hour and she still had not come to our room. You're clearly dragging your feet for whatever reason.
This is exactly what I meant with the poor communication. It is likely that this pediatrician who is a hospitalist has very sick, potentially life-threatening ill premature babies under her care. And I think that had Candace known that and not from her side, she doesn't see what's going on. But if she had a little more communication from the team and said, I promise she's trying to get there as soon as possible. She's not ignoring you. This is not punishment because you're asking to be discharged. She's just taking care of some really sick babies right now. And I promise she'll be here as soon as she possibly can. Like, that kind of communication would go a long way in this situation where you have a very frustrated patient. So I think that this is a really good example of where we devolve from Candace is sharing things that's bad information to Candace is sharing really important part of her story that should be a signal to us that as healthcare professionals that we need to make sure that we are compassionately and autonomously communicating with our patients.
2 minutes later, Dr. Wilson arrives and she comes in. This is the first time she has seen me. This is the first time she has seen my daughter. She goes over and does the obligatory check of the vitals, picks my daughter up, looks at her and says, congratulations. She looks very healthy. I say, great. She said, but I am not going to sign you out because we think that you should wait 20 hours because you declined the antibiotic.
It's not because you declined antibiotics. It's because you tested positive for GBS and that wasn't treated. The reason for not having been treated is irrelevant. You could decline them. You could not be able to get them. You could be allergic and we aren't able to give them to you. Whatever the reason, the observation time frame is recommended as a safeguard to catch any early signs or symptoms of GBS.
She said, well, I don't do that. She said, I once watched a baby die because their parents didn't wait 48 hours. And I thought,
the more I watch this back as I'm editing, the more I think that this part particularly indicates a really bad way of handling the situation on the part of the doctor that she's discussing right now. This is never an appropriate way to explain a risk that you're concerned about to your patient. Although I too have had a patient who lost a baby due to invasive group B strep disease, I don't think that this, especially in an already tense situation, is ever an effective or appropriate communication tactic. I don't like that.
This is hilarious. Exactly 48 hours is what you want to take this to. Exactly 40 hours. If you were genuinely concerned that there was going to be any harm to this child, how did you arrive at 48 hours exactly?
There's just really bad communication about why they're recommending things and what's going on. And it leaves room for interpretation of the requests or the recommendations as malice instead of giving the flat blanket reason we recommend the 48-hour observation, because in the studies we know that that's where early onset symptoms typically happen. And if we can intervene in those first 48 hours, we can make a huge difference in outcomes. So
could it be that insurance covers the hospital stay for exactly 48 hours, which means hospital profits? If you can keep every single couple that gives birth in that hospital for 48 hours, you are guaranteeing yourself a certain amount of money.
That is not how it works. Your pediatrician, who is very likely to be an hourly paid hospitalist who is employed by the hospital at an hourly rate that has nothing to do with what you do or how long you stay in the hospital, is not scheming against you and your insurance to get as much money as possible. It is in our best interest to get people out of the hospital as soon as possible, because that decreases our workload and opens up beds for other patients who need them in what is almost exclusively at this point an understaffed and overworked hospital ward. But again, what I'm hearing from you is that healthcare should be something free where people don't end up with massive bills. And if that's what you're saying, yes, I absolutely agree with you. We can agree on two things. Number one, you shouldn't be interrupted as many times as you've mentioned in this video while you're trying to rest after having a baby. And number two, universal healthcare.
Do you really want me to believe that you witnessed an infant that died, right? Even though the chances of that happening are quite literally, virtually 0%. You witnessed it happen because they decided.
No, not quite literally or virtually 0%.
By the way, when you say you watched an infant died, what do you mean you watched them die? You just watched an infant die?
I'm going to respond to this here and explain what doctors and nurses mean when they say things like this. But I do want to make it clear that it was not in any way appropriate for that doctor to say that to her in this situation. That's, again, this is not, you can't say things like that to patients. That's not okay. Once you've exhausted your ability to intervene with someone and they are so lethally and terminally ill with whatever their problem is that you can't do anything else, you watch them die. That's what watching them die means. That at some point, our medical capability of saving lives stops and we have to be present for people dying. That's just how it works.
I said, why don't you test her for GBS right now? She's here. We don't have to guess anymore. She said, we don't do that. We don't test them for GBS. Oh, okay. So you're concerned that she potentially is going to get strep B from me. You have the ability to test her for that because she's here. I mean, didn't you just come in 5 seconds ago and tell me that you had to do genetic testing, that you had to do it or I was going to face a misdemeanor, but now you can't include a simple GBS test? You could just go, you know what? She's negative. Go home. This is what I am talking about when I say there is hospital corruption. The baby is here. Test the baby. Why don't you test me? I've given birth 24 hours, so you could test me and see if I was even positive when I gave birth. They refused. It's just not protocol. We don't do that.
It's not protocol. It's unhelpful to the diagnosis. Maybe this was not relayed to you in an appropriate fashion, and this discussion perhaps could have been undertaken better. I absolutely will concede to that, but it's not protocol. It's not helpful. I understand why it would seem like this is an option that we could do, but the only way to diagnose GBS that is a neonatal onset and threatening is when that gets to a high enough point in the blood or cerebrospinal fluid that it causes sepsis or meningitis. And when that happens, then you can do a blood test and you can find it, which is why I said earlier that there's an easy test. But you can't do that before they're sick. You can watch for early signs and symptoms so that you intervene as soon as possible. It's not as simple as just doing a quick swab. Now, I also am confused because earlier she said that there was no way to test for this in general, and now she's very angry that they didn't test for it at that point. I'm not following her line of thinking here.
At any point, they could test you right as you're running in to give labor for GBS to see if you're still positive. Nope. We won't do it. We won't test you or the baby, but we will keep you for an extra 20 hours of monitoring so that we can guarantee ourselves profit. It's absolutely despicable.
No, it's not why. That's just not how this works. Medicine isn't magic. It is science. It takes time, and there are specific ways that things have to be undertaken for accurate diagnosis. What we're trying to avoid is sending you home and those early signs that can be recognized by a trained eye going unrecognized until there is so much damage that the baby is brought in severely ill and there's nothing that we can do to help them. That is why the 48-hour waiting period is recommended. And I'm sorry that there's no easy test for that. I can guarantee you if there were, we would be doing that. It just doesn't exist.
And I looked at her and I said, I don't think you're understanding. We're walking out right now, okay? I'm not going to do this with you. Here comes a woman out of an office who said that she was from social services and that she works in the hospital, but she represents social services. And I kid you not. And I could have been hallucinating, so maybe I am kidding you. She was wearing a badge that said, I am caffeinated, vaccinated, and activated. I was just going, somebody get me out of this nightmare. Somebody get me out of this insane asylum. And she said very kindly, I'm just here to inform you these forms that we're going to have you sign. If you sign that you are leaving against medical advice, then the insurance company may decline coverage, right? That's the you're too poor for this argument. You can't afford this.
So this is a very commonly held belief within the medical system of the US, but I actually didn't know this prior to now. I looked into it a little bit more, and insurances actually can't do that. So I have no doubt that they told her that thinking that it was true, but it doesn't seem like this actually happened. So that was a learning point for me, and I'm glad that she decided to bring it up in this video so that I could look it up. I wouldn't threaten a patient with that. I don't think that's appropriate anyway. I might inform them that I thought that was true, but I wouldn't weaponize it like they have here. But for the rest of us to know, this is not actually the case.
I wrote, there was a little spot where you could write something, and you've been informed. I said, we have a healthy child and a healthy mother, and we are going home. We signed it, and we left the hospital. That was it.
I personally don't use against medical advice paperwork. I think that a well-counseled patient can sign out on their own if they know the risks of doing that. That's a little different in a situation where it's a neonate. So pediatrics may not be on board with that, and they have to have you sign AMA paperwork.
The update to that story, which is so relevant, Child Protective Services never came to my house. And of course, insurance covered the entire stay. Now, all of this should serve as a reminder that we are indeed living in an administrative state. It's the CDC, it's the FDA, it's all of this policy and all of these bureaucrats, and none of this is about the health of a child or the health of an adult anymore. It's truth.
I obviously don't agree with this. I think almost every single thing that was brought up in this video, aside from the very horrible communication that she obviously had from her healthcare team and the constant interruptions when she was trying to rest, everything else was specifically about the health of her or her baby. So I don't think that this conspiracy that everything we recommend is a bureaucrat intervening and trying to put us under a surveillance state. I think it's science and evidence. Regardless, I understand that she is frustrated. I'm glad she shared her story. I just wish she would have done it without spreading so much misinformation about the harms of Group B strep and what it actually causes. Thank you for being here today. I hope that you learned something. I'll see you next Monday.